Welcome to HMSA's new provider orientation training session. My name is Jennifer, Network Management Representative with HMSA Provider Operations, and I'll be presenting today's webinar. First, we will share information about HMSA, so you will have some background about our organization. Next, we'll discuss how HMSA supports its participating providers with tools and resources to assist you in working with us, and tips on filing claims to reduce denials. Finally, we'll provide an overview of HMSA's plans and cover our primary care payment transformation initiative in more detail. So let's get started. These are the topics that we will cover in the first part of our orientation. HMSA has been in business for 80 years, and we have likely served several generations of our membership. We will discuss how HMSA supports providers and some of the teams you'll be working with. HMSA is a nonprofit, member-focused association, and we are an independent licensee of the Blue Cross and Blue Shield Association, a recognized and trusted brand. Our medical plans currently insure more than half of Hawaii's population and are accredited by the NCQA, the National Committee for Quality Assurance. We recognize the importance of our role in the community, and the HMSA Foundation provides funding for health-related projects and programs locally. As a nonprofit healthcare organization, HMSA's goal is to carefully manage our members' premiums to ensure the cost of care remains affordable and that members have access to services they need. We collect just enough premiums to pay for our members' health care and our expenses. For each dollar, HMSA collects 93 cents that is spent on our members' health care. The remaining 7 cents plus HMSA's investment income paid for running the Health Plan and Affordable Care Act, taxes, and fees. We aim to help over 7,000 of our participating providers statewide to operate their healthcare businesses as efficiently as possible. We offer a variety of services, including electronic claims filing, direct payment to participating providers, and electronic funds transfer. We have internet-based tools to verify member eligibility or request prior authorization of services. In addition, we support a web-based provider portal that houses our medical policies and essential and administrative information. This is a display of HMSA's contact list. It includes the phone numbers, email addresses, and links to information in today's presentation. This list will be available on our Provider Resource Center. Now here's more detail on HMSA's units that support our providers. The Provider Service Field Associates help with complex claims and reimbursement issues and are available to meet with you at your office. Our Provider Data Administration unit maintains information, including practice location, payee, and mailing address. That is important for claims processing. You work with this department when you registered as a new provider. Be sure to please notify HMSA of any changes to your information to ensure you are marketed in our provider directories and your claims are paid correctly. Our HMSA research and correspondence team responds to written inquiries from providers. Their address is included on the contact list. Our contracting and facility relations assist with provider contract development. We now introduce you to the wide variety of tools and resources available so you can do business effectively with HMSA. The provider portal holds much of the information you need to do business with HMSA. You can access it by going to the link provided here on this slide. Participating providers may access HHIN, Hawaii Healthcare Information Network, at no charge to receive information on member eligibility, benefit detail, and claim status. This secure website gives participating providers timely, on-demand information. On the contact list, we include numbers for HHIN outreach to request initial HHIN access or training. We also have our HIN help desk for HIN technical assistance. In 2009, HMSA saw an opportunity to bring to Hawaii a means of connecting patient and a physician using the internet or by phone. HMSA decided to make online care available to all Hawaii residents, regardless of their health care coverage. Online care is available at no cost to participating providers. Providers are paid for their visits, and weekly payments are sent electronically into their bank accounts. No claims need to be filed. Both PCPs and specialists can enroll in online care and be accessible to their patients. Choreo is our specialized web-based tool used by our physicians. It takes data from multiple resources and displays it in meaningful ways, and allows the provider to take action. It provides a longitudinal view of the patient by integrating both claims and clinical data, creating a community health record. This gives us a more complete picture of the patient's health. This slide is a sample screenshot of a PCP's performance screen in Choreo. We strongly believe that one of the keys to improving a person's overall health is to empower them by bringing awareness about their current physical, mental, and social state. To help us achieve this, we partnered with ShareCare, a company that specializes in health engagement. ShareCare has developed a state-of-the-art health platform and an easy-to-use, medically sound tool, the Real Age Assessment. Working with ShareCare, we strongly believe that one of the keys to improving a person's overall health is to empower them by bringing awareness about their physical, mental, and social state. To help us achieve this, we partner with ShareCare, a company that specializes in health engagement. ShareCare has developed a state-of-the-art health platform and an easy-to-use, medically sound tool, the Real Age Assessment. Working with ShareCare, we give our members and the rest of Hawaii an easy way to get involved, understand what's going on, and play an active role in their own health and well-being. The Real Age Assessment is available at hmsa.sharecare.com. The assessment gauges how fast we're aging based on lifestyle and medical history. Are you younger than your physical age or older? ShareCare also has a tool that patients can use to find a doctor. Patients can search by provider name, specialty, plans, or office location. Providers can create and personalize their profile to promote their practice. Now we move on to the pre-certification request and some of the tools and partners HMSA uses to review those requests. For the purpose of this training, the terms pre-certification, prior authorization, and pre-authorization are interchangeable. A good place to start is to know which services require pre-cert. The links of these resources are listed on the HMSA contact list under Pre-Authorization Requests section. Once you have determined that a service needs pre-certification, you have the ability to submit pre-certification requests electronically by logging in to HHIN. After logging on, you then have access to iExchange for prior authorizations requests reviewed by HMSA, such as certain medical surgical procedures or durable medical equipment, Evercore for rehab therapy services, RADMD through Magellan, formerly National Imaging Associates, for advanced imaging, selected spine and cardiac procedures, CVS Novologic tool for specialty drug prior authorization requests. iExchange is a secure web-based tool for providers to submit prior authorization requests for medical, surgical services, or durable medical equipment, DME. Providers may submit documentation electronically with real-time entry. Auto-approval rules are applied to selected services, and iExchange also provides status updates online. Magellan, formerly known as NIA, manages advanced imaging services and certain cardiac and selected spine procedures. NIA has considerable experience in the field of radiology management. ER observation and inpatient procedures do not require pre-certification. Here we list in more detail those services that are managed by Magellan. Requests may be submitted using the website or by phone. Links to additional information on the process are on the contact list. For services that are clinically urgent, defined as cases that cannot be postponed for 24 hours due to severe health risks for the patient, please use this dedicated phone line or RADMD to provide information on the case. If you are using RADMD, providers must select clinically urgent indication. Providers must support the need for the urgent request, and an authorization number is given at the end of the process. Evercore is our partner responsible for managing rehab therapy, which includes physical therapy, occupational therapy, and chiropractic services. Please note an exception. Speech therapy pre-authorization requests are sent to HMSA Medical Management and not to Evercore. HMSA's contact list contains links to more information on rehab therapy and Evercore's role. HMSA chose CVS Health to process our specialty drug prior authorization requests, administer our medical policies for specific drugs, and to apply clinical and claim ethics to these drugs. Specialty drugs must be filled by a participating specialty drug pharmacy in HMSA's network. Besides dispensing the drug, specialty pharmacies coordinate care between the patient, physician, and pharmacy. There are two categories of specialty drugs: medical specialty drugs administered by injection or infusion, and pharmacy specialty drugs taken orally or by inhalation. Specialty drugs are managed by CVS. A list of medical specialty drugs requiring pre-authorization is maintained by Caremark and is available using the link on the contact list. Requests may be submitted online using NovaLogix, which is accessed through HHIN. Requests may also be submitted by fax or phone. These numbers are included on the contact list as well. Review the patient-specific drug formulary to determine which pharmacy specialty drugs require pre-authorization. Requests may be submitted by fax or phone. NovaLogix may not be used to submit requests for pharmacy specialty drugs. Beacon Health Options has partnered with HMSA to provide utilization management services for behavioral health and substance abuse. For HMSA's PPO and HMO plans, Quest Integration, Medicare Advantage, Federal Plan 87, and Federal Employee Program plans. They provide concurrent review or pre-certify the services shown here. Beacon Health Options also provides case management support, reviews benefit predetermination requests for behavioral health services, and assists with psychiatric decision support and behavioral health referrals. HMSA's contact list includes links to more information and contact phone numbers for Beacon Health Options. Next, we'll talk about submitting claims to HMSA. Although many of the slides reference paper claim submissions, the same information needs to be included on the electronic claims as well. Prior to rendering services, providers should always check if the patient has HMSA coverage and if it is current. Providers may verify eligibility by logging on to HHIN, calling HMSA Member Connection, or by calling HMSA Quest Integration Provider Services. All are listed on the HMSA contact list. On the provider portal, we offer basic claims filing for the CMS 1500 claims form and an interactive training tool, which is a facsimile of the CMS 1500. Blocks are color-coded to identify required, conditionally required, optional, and not applicable blocks. Click on the block number to view a description for each block. The links for both are on the HMSA contact list. Here are some tips when filing your claims. Use original printed claim forms purchased from a form vendor. These forms have red lettering. Transposition errors are common. Ensure that member ID numbers, procedure codes, and diagnosis codes are correct prior to mailing. Clear, accurate information is essential for HMSA to process your claims correctly and without delay. Paper claims are scanned, and for that reason, highlighters and whiteout should not be used. Make sure that your claims are legible and all required and conditionally required fields are completed. HMSA encourages both participating and non-participating providers to submit claims electronically. Electronic claims result in faster processing and payment. Other available electronic transactions include eligibility verification, claim status, payment reports, and electronic fund transfer. If you would like to start submitting claims electronically, please see HMSA contact list for the number to call for assistance. We will now discuss the HMSA's programs. First, we cover some of the different health plans that HMSA offers. Then we'll move on to the other programs that you'll need to know about. First, we have PPO plans. PPO members may see the doctor of their choice. We recommend that patients select a PCP to establish a relationship with them. Patients have the lowest out-of-pocket costs if they receive services from participating providers. HMO plans offer an alternative to PPO plans. HMO members select a health center and PCP upon enrollment. HMO plans are managed care plans, meaning that most specialty services must be arranged by their PCP. Referrals are made with a patient's health center unless there is a medical reason why the patient needs to be referred out of network. An HMO membership card contains the patient's name, their ID number, their HMO health center, and their PCP's name. Use the member's coverage code information to view their member benefits on HHIN. PCPs will refer their HMO patients using the hierarchy shown here. A PCP's first choice would be to a provider within the patient's HMO health center. And if none is available, then to a provider in another HMO health center. If it is medically necessary to refer to a non-participating provider, the request must be sent to HMSA for administrative review. If services are rendered without a referral, claims will be denied, and members will be responsible for paying the service. The following are exceptions and do not require referrals: emergencies, urgent care, mental health, and vision exams. HMSA's care management support applies to HMSA PPO, HMO, and Medicare Advantage plans. HMSA has additional support available for members that could benefit from targeted, personalized help. Now let's take a look at HMSA's Quest Integration Plan. Quest Integration membership is comprised of 3 groups of eligible members: non-ABD, those who are not aged, blind, or with disabilities; ABD, members who are aged, blind, or with disabilities; ABD and LTSS, members who are aged, blind, or with disabilities and qualify for additional long-term services and support benefits after assessment by a service coordinator. This is a sample of the Quest Integration ID card. The plan name is in the upper right corner. If the member doesn't have their Quest Integration card yet, please verify eligibility through HHIN by calling Quest Integration Provider Services or by checking the state's online eligibility site. The Quest Integration Plan is a managed care plan with primary care providers responsible for coordinating specialty care for their patients. For this reason, the PCP's name is listed on the card. Also note that the benefit field identifies which group the member belongs to. Service coordination is a person-centered service delivery system that supports patients with special healthcare needs or those receiving long-term services and supports benefits. Service coordinators assist in coordinating services with other agencies, programs, and community resources, relieving the provider staff of those tasks. If you have a patient with conditions who you feel will benefit from the services of a service coordinator, please call Quest Integration Provider Services, listed on the HMSA contact list, and make a referral. When a patient is referred, the service coordinator will schedule a meeting with the patient at a site that is convenient for the patient. At that time, an assessment is done to determine the patient's needs. A personalized plan is created and sent to both the patient and their PCP. The service coordinator then arranges for contracted providers to deliver the care. HMSA Quest integration determines if the patient qualifies for service coordination. It is important to know Quest integration members cannot be balance billed. Payments to providers must be accepted as payment in full. No show fees may not be billed to Quest integration members. Next are some exceptions where members can be billed. Non-covered or upgraded services, members must sign a financial responsibility statement agreeing to pay for services before services are rendered. Services rendered before or after eligibility, as an exception, if a member loses coverage during an inpatient confinement, we can sometimes pay for their inpatient acute stay beyond a member's eligibility. Members who are retroactively disenrolled from our plan also present an unusual situation that will require special handling. If the services end up being covered by another entity, be sure to repay any HMSA Quest payment that was previously made on the claim. Primary insurance payments and cost shares are also billable to members. This section describes HMSA's Medicare Advantage plans, which are offered to Medicare-eligible members. HMSA offers a choice of 2 Akamai Advantage plans on each island, which are PPO plans. New since 2018 is an Essential Advantage HMO plan that is offered on Oahu. A dual care plan is available for members who qualify for both Medicare and Medicaid. Akamai Advantage is a Medicare-based plan which includes additional benefits over and above those included with original Medicare. As mentioned earlier, HMSA introduced a new Essential Advantage HMO plan for Oahu members in 2018. This managed care plan uses Hawaii Pacific Health Network to provide services. Members who are eligible for both Medicare and Quest integration may enroll in an Akamai Advantage dual care plan. When submitting claims, please file to the HMSA Akamai Advantage dual care first, then the member's Quest integration plan as secondary. The Akamai Advantage dual care plan does not combine Medicare and Medicaid benefits into a single health plan. Here is an example of the Akamai Advantage dual care membership card. The plan name appears at the top right corner of the front of the card. In most cases, dual care members have no premium after the low-income subsidy. Members in the dual care plan have access to services that are coordinated by a care manager, whose role is to ensure the seamless transition between care settings, providers, and services. Here we illustrate the model of care process for its Akamai Advantage dual care plan members. It starts with the care manager meeting with the patient to do a health risk assessment. This may be done in person, by phone, or by mail. Then those results are used by the interdisciplinary care team to create an individualized care plan for the patient. This section describes HMSA's information on excluded providers for the Quest Integration and Medicare Advantage plans. To be a part of HMSA's network, all providers must warn at the onset and for the duration of their contract that the providers or affiliated providers, which includes owners, agents, or managing employees, are not excluded from participating in federal or state health programs. If found to be excluded, HMSA is required to immediately terminate the provider from the HMSA provider network. In addition, providers must also warrant that they review excluded provider lists to confirm that employees or contractors are not on any list and review excluded provider lists prior to hiring staff. To view these lists, go to the links provided on the HMSA contact list. The lists are maintained for different reasons, so multiple lists may be checked. There are 2 lists for Medicare Advantage plans and 4 lists that apply to Quest integration. Here we have the Blue Card program. Blue Cross and Blue Shield plans nationwide process claims for one another whenever a plan's member receives services in another plan's service area. When you render services to a member of an out-of-state Blue Cross Blue Shield plan, claims are submitted to HMSA, and participating providers receive payment from HMSA. Payment is based on HMSA eligible charges. However, benefits, medical policies, and patient's co-payment or co-insurance amount are determined by the plan the member is enrolled in. When members of Blue plans arrive at your office or facility, be sure to ask them for their current Blue plan membership ID card. The first 3 characters of the member ID identify the Blue plan that the member is enrolled with. It is important to enter the entire membership ID on your Blue Card claim. Providers can check eligibility of a Blue Card member by submitting an electronic eligibility request via HHIN or by calling 1-800-676-2583. Providers may verify if services require pre-authorization by accessing the URL listed on the HMSA contact list or by calling the 1-800 number also on the contact list. Next, we will present an overview of the payment transformation model. So, as a new primary care provider or PCP with HMSA, you understand the program and how PCPs are paid under this program. The next few slides will cover an overview of HMSA's initiative. Through payment transformation, we want to achieve these goals: better health and well-being for our members, give doctors freedom to practice medicine as they would like to and achieve the triple aim relating to access, cost, and quality. This program affects new primary care providers in our audience today. As we talk about payment transformation, please keep in mind the overarching goals. We're moving from volume-based to value-based reimbursement, a journey that is being undertaken nationally by many payers, including CMS. Finally, we're emphasizing management of your entire patient panel, even those who aren't sick and don't see you very often, and promoting health and wellness. Payment is based on a per member per month payment for patients that are attributed to a PCP. The base per member per month PMPM includes office visits, newborn care, procedures such as surgeries, labs, and other tests performed by the PCP. The cost of vaccines themselves are not included in the monthly PMPM. This is because we recognize fluctuations in the cost of vaccines. They are paid separately on a fee-for-service basis. However, vaccine administration is included in the global payment. We want to point out that services for some members are not a part of the per member per month calculation. Claims for these members will still be paid fee for service. New PCPs likely will not meet minimum member months requirements under payment transformation. Instead, PCPs in a medical group will receive the medical group's PMPM. PCPs not in a medical group will be given the adult or pediatric network average base PMPM based on their specialty. To be eligible under HMSA's primary care compensation program, a primary care provider must be participating provider in all HMSA lines of business, commercial, Quest Integration, and Akamai Advantage. Be a credentialed primary care provider in one of the following: general practice, internal medicine, family medicine, pediatrics, naturopathic physician, advanced practice registered nurse, or a physician assistant under supervision of a payment transformation eligible provider. Finally, program eligibility. The primary care provider also must contract with a single physician organization. The physician organization is responsible for working with their providers to ensure access to care and quality. As part of the move to value-based payment, HMSA has established quality programs as part of our provider reimbursement. Global payment includes office visits, procedures, labs, EKGs, TBs, and other tests, injectable drug administered by PCPs, administration of vaccines. Newborn care and vaccine costs will be paid fee for service. Services excluded from global payment are facility-based services identified by the place of service codes found in Appendix B of the Payment Transformation Guide and reported in Field 24B on professional claims will be paid fee for service for dates of services on or after July 1st, 2018. Under HMSA's quality performance programs, the maximum payment potential is dependent on the patient panel size and performance for each measure. For a detailed look at HMSA's primary care quality program, please refer to the Payment Transformation Program Guide link listed on the HMSA contact list. This brings us to the end of our orientation session. If you have any questions regarding our new provider orientation presentation, please email us at psinquiries@hmsa.com. HMSA welcomes you and looks forward to working together to serve our community and our members. Thank you.